The U.S. is on the verge of reaching a grim milestone, 1 million COVID deaths. The CDC says it's a number we're likely to hit in the next few weeks. Johns Hopkins University reports more than 988,000 deaths in the U.S. are linked to COVID right now. The Center for Disease Control predicts another 11,000 people are likely to die within 4 weeks. And cases are beginning to tick back up, fueled by that Omicron subvariant that's already caused surges in other parts of the world. The latest data from Johns Hopkins University shows we're still well below previous peaks, but are now averaging nearly 40,000 confirmed cases per day. We were in the high 20,000s at the beginning of the month. Still, U.S. hospitalizations remain down. The 7-day average of hospitalizations remains just below 15,000, which is actually a fraction of what they were during the height of the Omicron surge earlier this year. Joining us now is Dr. Ramon Lorenzo Redondo, Assistant Professor of Medicine in the Division of Infectious Diseases at Feinberg School of Medicine at Northwestern University. Dr. Redondo, glad to have you here again. Philadelphia became the first major U.S. city to reinstate indoor mask mandates as cases began to tick up. Do you think this is a case of being extremely cautious, or do you think more cities and states should or will follow in Philadelphia's footsteps?
Well, if the cases follow the trend that some European countries have already observed, and then some of the data that we are obtaining, for example, from wastewater surveillance that goes maybe a little bit ahead of the cases, and the cases that are still that are starting to grow, especially in some of the most densely populated areas, it might not be overly cautious, especially thinking that these measures are not very restrictive. It's just a caution that probably doesn't cost that much effort. So I think it's not a bad idea. Also taking into account that now we are dealing with an extremely contagious variant of the virus that especially is very contagious indoors. It might not be a bad idea to instate these policies, especially when we can be more preventive than reactive to the cases. So we could, by doing this type of measures, maybe prevent an outbreak or prevent a sudden increase in cases. So I don't think it's a bad idea. And then once especially all these policies need to follow data, need to follow the trend. They have to have objective reasons. Then once you see that the trend is under control again, then you very easily can remove them again. So I think it's not a bad idea. And maybe if the trends of some other countries are followed here, and still is yet to be seen, but we know that BA2, the sublineage of Omicron, is now the most predominant. This is highly contagious. So it wouldn't be rare to see that we observe an increase in cases.
Sure. As you said, preventive over reactive is a good way to look at it. So Congress did adjourn for its spring recess this week before being able to pass a supplemental COVID funding relief package. So what kind of negative impact could a lack of funding right now have on the pandemic?
Yeah, so it's still yet to be seen, but there's some confusion right now about the funding and the specific funding for research or studies in SARS-CoV-2. The main thing is that we have seen that the investment in this type of research or aids in investigation have a big return. So we have to understand that we need to invest more. We have developed very good tools, but it's not enough, especially if new waves and new variants keep being developed. And another area that is also very important is global health. So we need still, even if we cover ourselves and we have enough supply, we need to probably, for our own sake too, help other countries with less resources, especially in African nations or in South American or Central American nations where vaccination, treatments are not still available or available in big proportions. So a combination of all of these, we need to think about it. We need to probably invest more in new vaccines or new derivatives of the vaccines that so successfully have been deployed. We need to invest more in research in treatment, and also we need to understand the virus and the characteristics of the virus even better, because so far there's a lot of unknowns. So all of this comes from this money and this funding. So I think it could have some consequences. So hopefully they solve these problems and start the funding again soon.
All right, Dr. Ramon Lorenzo Redondo, as always, thank you for being here.
Thank you very much.